When it comes to men's health after 60, the word prostate often comes with a heavy dose of anxiety. Most men hear prostate symptoms and their minds jump straight to cancer. But the real story is that the vast majority of urinary changes that happen as we age are not cancer. However, knowing the subtle differences between a common, benign issue and a potential warning sign is the key to your peace of mind and your long-term health. This isn't just about a medical diagnosis. This is about the quality of your daily life. It's about getting a full night of uninterrupted sleep, feeling confident on a long drive without planning every rest stop, and enjoying your retirement without a cloud of worry hanging over you. In this video, we are going to calmly and clearly walk through 10 early signs related to prostate health that men mustn't ignore. For each one, I'll explain exactly what's happening inside your body in simple terms. We'll discuss what's often a perfectly benign change, and most importantly, we'll pinpoint the specific moment when it becomes a clear signal to call your doctor. And please, stay with me to the very end. I've put together a simple, when to call the doctor checklist that summarizes everything, which will help you organize your thoughts and make that conversation with your healthcare provider incredibly productive. This is about information, not alarm. My only goal today is to replace your worry with clarity and confidence. If you're here because you're looking for reliable, no-nonsense health guidance for yourself or for a man you love, you are in the right place. This is a community for taking control of our health as we age. Consider subscribing so you don't miss our future videos. We would be so glad to have you with us. All right, let's begin with the sign that disrupts life more than any other. Sign number 1, frequent urination, especially at night. This is often the first thing men notice. You used to sleep through the night, but now you're up 2, 3, maybe even 4 times. Doctors have a name for it, nocturia, but what's actually going on? The mechanism is simple, and it's all about location. Your prostate gland is a small, walnut-shaped organ that sits right below your bladder and wraps around the urethra, which is the tube that carries urine out of your body. Think of your urethra as a perfectly clear garden hose. As men age, the prostate naturally tends to grow larger. This is a non-cancerous condition called benign prostatic hyperplasia, or BPH, and it affects about 50% of men in their 60s and up to 90% of men over 80. When that prostate gland enlarges, it's like a fist gently squeezing that garden hose. This pinching action means your bladder has to work much harder to push the urine out. Because of that restriction, it often can't empty itself completely. With urine still left in the bladder, it doesn't take long for it to fill up again, triggering that urge to go. At night, when your body is naturally producing urine, this cycle becomes especially disruptive. The relatable scenario is that feeling of frustration. You finally get comfortable in bed, drift off, and then that familiar pressure in your lower abdomen wakes you up. You go to the bathroom, and it feels like very little comes out for all the trouble. An hour or two later, the cycle repeats. You wake up in the morning feeling more tired than when you went to bed. Now, don't panic. Getting up once a night can be a normal part of aging. But if this is a new change, if you're going from 0 trips to 3 or 4, or if it's getting progressively worse, it's time to start a conversation with your doctor. It's most likely BPH, for which there are many effective treatments, but it needs to be properly diagnosed. Let's move on to the second sign, which is directly related to the first. Sign number 2, a weak or interrupted urine stream. This is another classic symptom caused by that same squeezed garden hose effect. When the urethra is narrowed by an enlarged prostate, the flow of urine naturally loses its force. The mechanism is pure physics. Your bladder muscle, the detrusor, is strong, but it's designed to push urine through an open tube. When it has to force that same fluid through a pinched opening, the pressure drops. The result is a stream that is noticeably weaker than it used to be. It might also start, then stop, then start again, as your bladder struggles to maintain consistent pressure against the obstruction. You might recognize this scenario. You're standing at the toilet, and it feels like it takes forever to finish. You might see other men come and go in a public restroom while you're still there. It can feel embarrassing, but it's incredibly common. You might also notice that the stream doesn't arc like it used to. Instead, it goes almost straight down. As with nighttime urination, this is a hallmark sign of BPH. It doesn't automatically signal cancer. However, a stream that is getting progressively weaker is a sign that the obstruction is getting worse. A simple, practical step is to try double voiding. After you finish urinating, wait for about 30 seconds, relax, and then gently try to go again. You might be surprised that a little more comes out. This helps empty the bladder more completely. The red flag line here is when this weak stream is combined with a feeling of straining or pushing to get the urine out. If you feel like you have to tense your abdominal muscles to urinate, that's a sign your bladder is working too hard, and you should definitely get it checked out. This brings us directly to our third point. Sign number 3. Difficulty starting urination, also known as hesitancy. You feel the urgent need to go. You're standing in front of the toilet, but for several long seconds, nothing happens. That delay is called hesitancy. The mechanism here is a battle between two forces. Your bladder is signaling that it's full and ready to empty, and it's starting to contract. But the enlarged prostate is blocking the exit. Your body's nervous system gets a mixed signal. The go signal from the bladder is met with a stop signal from the obstruction. It takes a few moments for the bladder muscle to build up enough pressure to overcome the resistance and force the urine out. The flip side of this is difficulty stopping urination. You think you're done, but as you walk away, you experience a little bit of leakage or dribbling. This happens because the same obstruction that makes it hard to start also prevents the sphincter muscle from closing off cleanly and decisively at the end. The relatable scenario is one of mild anxiety. You might start avoiding public restrooms because you feel self-conscious about how long it takes to get started. You might develop a habit of wearing darker pants just in case there's some post-urination dribble. It's a small thing, but it can slowly erode your confidence. Again, this is far more likely to be BPH than anything more serious. A simple tip is to take a deep breath and consciously relax your pelvic floor muscles before you try to urinate. Tension makes hesitancy worse. However, if that delay at the beginning gets longer and longer, or if the dribbling afterward becomes more pronounced, it's a clear sign that the mechanics of your urinary system are under strain and a medical evaluation is warranted. Next up is the persistent feeling that comes from all these issues combined. Sign number 4, a sensation of incomplete bladder emptying. This is that nagging feeling that even after you've just been to the bathroom, your bladder isn't truly empty. You might walk out of the restroom and, within minutes, feel that familiar pressure starting to build again. The mechanism is simple. You're right. Your bladder isn't empty. The prostate, by squeezing the urethra, creates a physical barrier. No matter how hard your bladder muscle pushes, it might not be able to expel all the urine past that blockage. The urine that remains is called post-void residual urine. This is more than just an annoyance. That pool of stagnant, leftover urine in the bladder is the perfect breeding ground for bacteria. This is why men with significant BPH are at a higher risk for developing urinary tract infections, or UTIs, which can be quite painful and sometimes lead to more serious kidney infections. The common scenario is a feeling of being tethered to the bathroom. You can't comfortably sit through a 2-hour movie. You hesitate to go on a long walk or a hike because you're not sure where the next restroom will be. This one symptom can significantly limit your freedom and spontaneity. If you constantly feel like you need to urinate again shortly after you've just gone, that is a very important symptom to report to your doctor. They can perform a simple, painless ultrasound scan on your bladder right after you urinate to see exactly how much urine is being left behind. This gives them a clear picture of how significant the blockage is. Now, we shift from symptoms of blockage to symptoms of irritation. Sign number 5, pain or a burning sensation during urination. This symptom is a different category from the first four. While the others are about plumbing and pressure, this one is about inflammation or infection. The mechanism here can be one of several things. The most common cause is a urinary tract infection, where bacteria have irritated the lining of your bladder or urethra, causing a classic burning or stinging sensation. Another common cause is prostatitis, which is simply inflammation of the prostate gland itself. Prostatitis can be caused by a bacterial infection, but often it's not. In rarer cases, a tumor within the prostate could grow in a way that irritates the urethra or bladder neck, causing pain. The relatable scenario is unmistakable. You go to urinate, and instead of relief, you feel a sharp, uncomfortable, burning sensation. It's a clear signal from your body that something is not right. Some men might also experience pain during ejaculation, which can also be a sign of prostatitis. This is not a symptom to watch and wait on. While a UTI or prostatitis are both very treatable with medication, you need a proper diagnosis to know what you're dealing with. Unlike the slow, gradual changes of a weak stream, any new onset of pain with urination is your body's alarm bell. It's a definite sign to make a doctor's appointment promptly. If this breakdown is helping you connect the dots, a quick tap on the subscribe button ensures you won't miss our future deep dives into senior health. Let's move to a sign that can be very alarming, but it's crucial to understand the context. Sign number 6, blood in the urine or semen. Seeing blood where it shouldn't be is understandably frightening. The medical term for blood in the urine is hematuria, and for blood in the semen, it's hematospermia. Let's talk about the mechanism. The prostate gland has a very rich blood supply, full of tiny, delicate vessels. Anything that causes inflammation or disruption in the area can cause one of these small vessels to leak. This could be a vigorous infection like prostatitis. It could be from the friction of a kidney stone passing through. And yes, it can be a sign of cancer in the prostate, bladder, or kidneys, as tumors can develop their own fragile blood vessels that bleed easily. The don't panic framing is important here. A single, isolated instance of a pinkish tinge in the semen, for example, can sometimes happen after a long period of abstinence or from vigorous sexual activity and may resolve on its own. However, you cannot and should not assume this. The red flag is unavoidable. Any visible blood in the urine or semen, even if it's just one time and even if there's no pain, must be evaluated by a doctor. Period. It is an absolute rule. While there are many benign causes, the serious ones must be ruled out by a professional. Your doctor will likely order a urine test and may recommend further imaging or a cystoscopy, where they use a tiny camera to look inside the bladder. Don't delay on this one. Now, let's take a moment to bust a very common myth. Many people believe that if your PSA blood test is high, it automatically means you have prostate cancer. This is simply not true. PSA stands for prostate-specific antigen, a protein made by prostate cells. A high PSA level is like a smoke detector going off. It tells you there might be a fire, but it could also be triggered by burnt toast. Things like a benignly enlarged prostate, BPH, a prostate infection, a recent urinary catheter, or even a long bicycle ride can cause PSA levels to rise. A doctor never looks at a single PSA number in isolation. They look at the trend over time, the rate of change, and consider it alongside your physical exam and symptoms. A high PSA is a reason for a conversation, not a reason for panic. Okay, let's move to a symptom that occurs outside the urinary system. Sign number 7. New and persistent pain in the lower back, hips, or pelvis. This sign is different because it's often associated with prostate cancer that has started to spread beyond the gland itself. The mechanism here is called metastasis. If prostate cancer is not caught early, cancer cells can break away and travel through the bloodstream or lymphatic system to other parts of the body. For prostate cancer, one of the most common places it spreads to is the bones, particularly the bones of the pelvis, lower spine, and hips. When cancer cells settle in the bone, they can cause a deep, dull, aching pain. Now, let's be very clear. The vast majority of backaches and hip pain in men over 60 have absolutely nothing to do with cancer. It's far more likely to be osteoarthritis, a pulled muscle from gardening, or spinal stenosis. The key differentiators are that this pain is new, it's persistent, it doesn't go away with rest, and it's not linked to any specific injury. It might even be worse at night. The relatable scenario is a nagging ache deep in your hip that you can't seem to stretch out, or a constant pain in your lower back that isn't relieved by your favorite recliner or a heating pad. The red flag here is the combination. If you are experiencing some of the urinary symptoms we've already discussed, and you develop this new, unexplained, persistent bone pain, that combination is a critical signal. You need to see your doctor and specifically mention both sets of symptoms so they can connect the dots. Our next sign is also a whole body symptom. Sign number 8. Unexplained weight loss or significant fatigue. Losing weight without trying might sound good in theory, but it can be a serious sign that something is wrong internally. The same goes for a level of fatigue that goes far beyond normal tiredness. The mechanism is about energy. Advanced cancers are metabolically active. They hijack the body's resources and burn a tremendous amount of calories to fuel their growth. This can lead to noticeable weight loss even when you're eating normally. This constant internal battle also drains your body's energy reserves, leading to a profound sense of fatigue that isn't relieved by a good night's sleep. The relatable scenario might be noticing your belt needs to be tightened by an extra notch, or your pants feel much looser, even though your diet hasn't changed. The fatigue is like hitting a wall. An activity you used to do easily, like walking 18 holes of golf or playing with your grandchildren, now leaves you completely exhausted for the rest of the day. Like bone pain, these are nonspecific symptoms. Many other conditions, like thyroid problems or diabetes, can cause them. But the red flag is, once again, the context. If unexplained weight loss or crushing fatigue is happening at the same time as new urinary symptoms or bone pain, it raises the level of concern and requires a thorough medical investigation. Next, a sensitive topic, but one that's important to discuss. Sign number 9. A new onset of erectile dysfunction. Erectile dysfunction, or ED, is extremely common as men age. But a sudden change in function can sometimes be related to the prostate. The mechanism is again about anatomy. The delicate bundles of nerves and blood vessels that are responsible for creating an erection run right alongside the prostate gland. A growing prostate tumor can press on, pinch, or even damage these structures. This interference can disrupt the signals from the brain and the blood flow needed to achieve and maintain an erection. It is crucial to frame this correctly. Most ED is not caused by prostate cancer. It is far more commonly linked to cardiovascular issues, diabetes, high blood pressure, medication side effects, or psychological factors. It is almost never the first or only sign of prostate cancer. The key here is the timing. We're talking about a relatively new and sudden change in erectile function, especially if it appears in conjunction with some of the urinary symptoms we've been discussing. If you've been having urinary issues and then, over a period of a few months, notice a significant decline in erectile performance, it's worth mentioning both to your doctor. They are pieces of the same puzzle. Finally, a less common but still important sign. Sign number 10, changes in bowel habits. This might seem unrelated, but it comes down to the tight quarters in your pelvis. The mechanism is purely mechanical. Your prostate gland sits directly in front of your rectum. If the prostate becomes very significantly enlarged, either from advanced BPH or a large tumor, it can physically press backward on the rectum, narrowing the passage. This can lead to symptoms like constipation, a feeling that your bowel isn't emptying completely, or a change in the shape of your stool. This is a much less common sign than the urinary symptoms. Most bowel habit changes are related to diet, hydration, or lack of fiber. You should always address those factors first. However, if you've made no changes to your diet and are well hydrated, but you develop new and persistent constipation alongside significant urinary symptoms, it could indicate that the prostate has grown large enough to affect its neighbors. It's another piece of information to add to the picture you present to your doctor. So, we've covered a lot of ground. What's the take-home message, and what can you do this week? The key thing to remember is that most of these symptoms, especially the urinary ones, are far more likely to be caused by the benign enlargement of the prostate, BPH, than by cancer. But you cannot know for sure without an evaluation. Your job is not to diagnose yourself. It's to be a good observer of your own body so you can give your doctor clear, accurate information. Here is your simple action plan. The when to call the doctor checklist I promised. Take out a piece of paper or open a note on your phone. Write down these 5 categories. 1. Urinary flow. Weak stream, straining, hesitancy, dribbling. 2. Urinary frequency. How many times at night? How often during the day? 3. Bladder sensation. Feel empty after you go? Constant urge. 4. Pain or blood. Any burning? Any visible blood in urine or semen? Yes/no. 5. Other body changes. New bone pain? Unexplained weight loss? New ED? For the next 3 to 5 days, just make a simple note next to each category. You're not a doctor, you're a detective gathering clues. This simple log transforms a vague worry like, I think I'm urinating more, into a concrete fact like, I'm getting up 4 times a night, and my stream is weak. That is incredibly powerful information for your doctor. Taking this step is how you move from anxiety to action. For your convenience, I'll also link to some excellent, plain language resources from trusted medical institutions in the description below. What's one small step you'll take this week after watching this video? Maybe it's starting that log, or making the phone call to your doctor's office. Let us know in the comments below. Sharing your plan can truly encourage someone else who is feeling worried. If this video brought you some clarity today, please give it a like and consider sharing it with a friend, a brother, or a husband who it might help. Your health is your most valuable asset. Stay well, stay informed, and I'll see you in the next video.